Okay, my name is Mia Scotland. I'm a clinical psychologist by training, and I now also work as a birth doula. A birth doula is somebody who is an emotional support for a birthing mum. So she chooses her birth doula, gets to know her birth doula during the pregnancy, and then the birth doula attends the birth. So there's that continuity, if you like, of being able to get to know the person and have them there for the duration of their labour. No matter how long the labour goes on for, the doula stays with her. And then the doula will also go and see her after the birth, again, to provide support and just help mum establish breastfeeding or whatever. You have birth doulas and postnatal doulas. A lot of doulas are both. I'm trained as a birth doula. I'm not trained as a postnatal doula, but I do see women afterwards and work with them, usually in a psychological capacity if there are any issues that they could do with. You might ask, why would somebody need or want a doula, especially when there's midwifery support around, and a doula isn't a midwife, so I have nothing to do with the medical element or the risk element at all, just there for the emotional support. The word doula actually comes from Greek word for female servant or female slave, so it's about being there for the mum, 100% for the mum. And it came about, the doula profession came about from a piece of research that was done where inadvertently it became obvious that if you have a woman in the labour room with a labouring mum throughout her labour, you impact on her outcomes. So this research wanted to look at outcomes, so it had somebody just taking notes throughout the labour, and what they found was that they were skewing the data because the women with somebody in the room taking notes were doing better than the women without that. So it became obvious that just having somebody there makes a big difference. So we know from the research, and there's been research since, to suggest that having that continuity and that emotional support makes a big difference to outcome. So I find that people usually choose me to be their doula for a number of reasons. The partners are involved. I very rarely doula instead of a dad. I'm there to support both of them. I'm there to support the dad and the mum, because I think as a dad it can be quite something to be at a birth, and I think actually we underestimate how much support dads need when their loved ones are having babies. Mostly people choose me to be their doula because they want a natural birth, and they believe that having me there as an advocate, as a support, and as somebody who knows and trusts natural birth will help them to achieve that natural birth outcome. So sometimes I'm hired because they feel they need that advocate, and they're a little bit frightened of the NHS system, and I think that's a shame when that happens. So obviously, to a great extent, my job is to help mum feel safe in that system, and to help the midwife support the mum in that system if it is that she's frightened of. Which can be quite difficult because I'm not a member of the NHS, but I'm stepping into a hospital probably half of the time. The other half of the time I'm at home birth. And I think it can be quite difficult because I've developed that relationship with the mum. I'm clear about what she wants and why she wants it, and my job is to communicate that with the midwives often if she's asked me to do that. And I think that can be quite... So my job is immediately to kind of help us all work as a team. And sometimes that's lovely and it goes really, really well and it's fabulous. And sometimes it isn't so easy. Sometimes I think midwives find it a bit hard for me to be there as the emotional support that they like to be. I mean, that is a midwife's job, isn't it? And I think actually I view my role of a doula as hopefully being short term. I want to be redundant because I want to see the day when that continuity of care is available, when a woman sees the same midwife during her pregnancy and has the same midwife attend her birth and sees that midwife after her labour. When that happens, and if that happens in the NHS, my job will be almost redundant because I'm stepping in, as I see it, in that role that at the moment the NHS isn't managing to provide, despite the fact that we know how important that is for normalising birth and for creating optimum birth outcome. I do have an easy job because I don't have any of the risk to worry about. I don't have to do any note taking. I can just be there. I can do the lovely part, smile at mum, be there for her, make her drinks, and just enjoy the birth. So in that sense, my job is actually quite easy. I don't have the stress. I don't get paid very well for it, but I love it. Absolutely love it. I don't do that much of it because obviously it's a great drain on my family time, having to be on call for 4 weeks at a time. I can't have a drink. But when I do it, I do love it. So in order to become a doula, I did it with Doula UK. There's different organisations that train up doulas. Some are shorter, some are longer. I chose Doula UK because the training was with Michel Audin and I wanted to sit and listen to him for 4 days, which I did, which was fabulous. And then you get mentored. So I was mentored through 4 births where I had to do reflective practice and talk through and demonstrate that I was able to be reflective and to learn. And then my mentor decided that yes, that was fine for me then to go off and work independently. So it's quite a short training because actually it's about you. You bring yourself as a doula to the birth and your care and attention. That's kind of the most important thing. But what tends to happen with doulas is because they have a passion for natural birth and for better birth, they tend to know actually an awful lot about natural birth. And so that's sometimes what a doula brings is that knowledge and trust in natural childbirth that some women want to kind of give them that also that trust and help them through what they want, which is usually a natural birth. So some women want to know that the doula understands the system or knows the hospital. So wants that kind of sense that the doula maybe even has met midwives in that hospital. That puts a lot of women at ease sometimes. They like the fact that you do know the hospital and you do know the midwives within that hospital to some extent. So although there isn't much to the training of being a doula, actually it's becoming quite a professional thing in itself, in that doulas spend a lot of time researching, getting to know about birth, going on courses. I mean, I update my training regularly because I'm passionate about it. And there's a professional body behind me, supporting me, that I pay money to, etc., etc. So it's becoming more professionalised, which some doulas don't agree with and don't like. And others obviously support and allow to happen. In terms of costs, I think because there's a short amount of training with a doula and you don't need anything to access that training, a doula can be from all walks of life, and so in that sense, I mean, as a clinical psychologist, I can maybe charge a little bit more, and I charge £500 per birth. So that's taking the woman with her antenatal care, being there for the birth no matter how long it is, and seeing her after the birth for 1 or 2 sessions. That's the kind of package, if you like. But that's kind of quite standard. I think most doulas charge anything between 400 and in London they'll go up to 800, 900. Doulas are very popular in London. It's just kind of something that has kind of gained popularity there. I think sometimes because of that kind of blurring between are we professionals or aren't we, sometimes it's not obvious what a doula is offering or in what way a doula is different to any other friend that the woman might bring or a midwife. And I think that every doula brings something separately maybe, but one of the things I certainly bring as a doula is faith in that woman's ability to birth. So I kind of keep the hope alive, if you like, throughout the labour and provide that I'm not frightened. I think sometimes a loved one, a father or a mother of the woman who's labouring, there's a lot of emotional investment in that day, and their anxiety unwittingly can impact on the labour room and the process of the birth. A doula doesn't bring her anxiety into the room. That's incredibly important, and I think that's one of the benefits of having a doula there. Likewise, she doesn't have to worry about risk and what might go wrong and attending to that in the same way that a midwife would have to, so she's got that added benefit as well. So a doula brings her non-emotional involvement in a way, but brings emotional support. So in the few instances where there has been an emergency, I've been able to completely attend to the mother's well-being while everybody's attending to what needs to happen and to the baby. And I think that's quite important we know that's important in reducing things like trauma following childbirth, is that personal interaction that the mum maintains. I think it's quite difficult for me as a doula sometimes to step into hospital with a birthing mum, because it's not my birth, it's not my show at all. So I wouldn't actually say to the midwife, I'm a doula and this is why I'm doing this. I would just say I'm Mia. Sometimes the midwife knows I'm a doula, sometimes she doesn't. That's down to the mum to tell her, really, not me. And sometimes when I'm at a birth, there's an immediate sense of connection with the midwife, and we're working together, and that just creates a really nice atmosphere in the room, and that's just nice, isn't it? It's nice when you're working with people that you feel you get on with, and they're there to support you. And if midwives have ever kind of really included me, like asked me to help with breastfeeding, for example, that also feels really nice, because you think, well, yeah, they're really understanding that actually I'm a little bit more than a birth companion. Sometimes it's difficult because maybe when I'm advocating for the mom, I sometimes feel that midwives are thinking I'm talking for the mom, I'm making decisions on her behalf, and I'm absolutely not. And that can be quite tricky sometimes. I have to be very, very careful to make it clear that I'm not saying she doesn't want an epidural because I think she shouldn't have an epidural. I'm saying she doesn't want an epidural because I know she doesn't want an epidural. And that can be quite difficult sometimes to communicate that with midwives who maybe think I'm making decisions that I shouldn't be making. And that can become uncomfortable sometimes. It's a bit of a shame. And there's nothing better than going to a birth where I already know the midwife. That's just lovely. But most of the time when I go to births, I don't know the midwife, because obviously there's a lot of you and I only do probably 5 or 6 births a year.